This lesson is about the use of cognitive behavioral therapy to guide conversations, goal setting, and to monitor and evaluate a participant. The objectives for this lesson are to identify the principles of CBT, discuss why CBT may be needed, and then to provide some examples of conversations using CBT. Cognitive behavioral therapy, usually called CBT, is a short-term, goal-oriented psychotherapeutic approach which is founded on the idea that thoughts cause feelings and consequently behavior. CBT principles are that negative thoughts can block the ability to take action. An example of this is not believing the exercises will help improve strength or balance. In addition, negative thoughts can block learning new behaviors. An example of this is not doing exercises to improve balance and sitting in the recliner all the time. Here's our first checkpoint. Which of the following is a principle of CBT? Is it negative thoughts are healthy, they can block new ideas, or they can block the ability to take action? The correct answer is negative thoughts can block the ability to take action. So there are two elements of CBT, psychological and behavioral. The psychological component emphasizes the significance of the meaning placed on things and how patterns of thinking are established. The behavioral component examines problems, behaviors, and thoughts. CBT combines both the psychological and behavioral therapy. It includes assessment, reconceptualization, skill acquisition, and application. The picture shown depicts how a situation like getting a cancer diagnosis can impact your thoughts, which can create a physical reaction like sweating and affect your mood or feelings, making you sad. In addition, your thoughts can impact your behavior, which also can create a physical reaction, like not taking a pill because you're nauseated, and it can also affect your mood or feelings, making you distressed because the pill was needed to combat something like hypertension. In addition, as shown, a physical reaction and your mood or feelings can impact each other. In other words, everything is interrelated. It's unclear what promotes behavior change. We do know there are many factors that can impact behavior change, but there is no single or simple solution. In a review of the literature, it does show that both MI, motivational interviewing, and CBT, cognitive behavior therapy, are somewhat effective. Here's another checkpoint, true or false. Factors that impact behavior change are often multifactorial with no single or simple solution. The correct answer is true. Determinants of behavior change are often multifactorial with no single or simple solution. Experts believe CBT is an essential component of change. However, it's not always enough. Others report a barrier to change is motivation. So most of the time, we recommend that using MI and CBT in combination is needed to promote behavior change, especially in challenging cases or for those with complex conditions, like the majority of my choice participants. Here's another checkpoint. What is a major barrier to behavior change? Is it education, motivation, or health literacy? The correct answer is motivation. So combining MI and CBT means that you would use a brief, focused, collaborative conversation guided by an assessment of the person using empathy, doing some elicited motivational conversation points, and then looking at readiness to change and discrepancies examined so they can be addressed later. So the application of the skills need to be goal-oriented, centered on a person's choice, and adapted to the person's environment, lifestyle, and actually what their choice is. So here are some examples of MI and CBT talking points that can be used. The RN says, I'm going to discuss your care at home regarding your treatment. You and your doctor have decided that taking this medication is the right choice for you. It's important to understand how to go about managing your medication at home. And here's another. Together, we will decide what things will work best for you, and you will decide what your goals are. We will work with the doctor as a team to help make managing at home easier. And here's an example of readiness for change assessment discussion. The RN says taking a new medication is important and requires a change to your usual routine. How ready are you to make these changes? And it's important for me to get a better understanding of how ready you are for change, so I'm going to ask you a few questions. Is it all right if we proceed? And then, on a scale of 0 to 10, with 0 being not ready, and 5 being considering change, and 10 ready to change, how ready are you for a change? And how important is this change to you? How confident are you that you can make this change? For those with less than a 10, you could say, why did you choose 7 and not a 10? What would happen to make this a 10? And here's an example of a medication adherence discussion. The RN would say, first we're going to discuss your medication to figure out what you know about it, and if you need more information. Have you ever forgotten to take a pill in the past 7 days? What would you do if you forgot to take your medication? What happens when you take your medication less often than prescribed? Would you skip or stop taking your medication because you did not think it was working? Would you skip or stop taking your medication because it made you feel bad? Have you ever taken more pills than you were prescribed to take in the last 7 days? And what happens when you take your medication more often than prescribed? And here's an example of a conversation that a RN could have regarding goal setting. Next, we're going to discuss things you can do to take your medication properly at home. What ideas do you have to help you remember to take your medication? Do you take your medication at the same time you usually do something else, like eat breakfast, brush your teeth, or weigh yourself? How do you know if you're reaching your goals? What goals do you have for the next week regarding taking your medication? So here's a case study of a real-life My Choice participant who received this model of care during our pilot study. Prior to receiving the new model of care, this person had been in My Choice for 8 years. He was a 51-year-old male who lived alone in a rental home with a history of anxiety, arthritis, depression, hypertension, GERD, alcoholism, illicit drug use, cataracts, and glaucoma. On assessment, he was unable to perform his ADLs and IADLs and had great difficulty with bathing, transferring, and ambulating. He had constipation and diarrhea at times and vomiting when he smelled food. He couldn't eat meat because it got stuck in his throat. He had sleep apnea, but the company took back the CPAP machine, and the power and heat were turned off on occasion, and the home was had boarded up windows. His goals were to improve his ability to bathe, transfer, ambulate, and elevate his mood. Here's the focus of his person-centered service plan. Improve ADLs, obtain some assistive devices, prevent falls, a couple home modifications, especially in turning back on the utilities, and medication management. To you, these may seem like they should have been taken care of in the My Choice program, but notably, he'd been in the program for 8 years and had not received the services. Here's how you would use a combination of MI and CBT for this person. Here's an example of a couple conversation points. I'm going to discuss your lack of utilities and unsafe living environment. You decided that living here is the right choice for you. It's important to understand how to go about turning the utilities back on and getting the management company to fix your windows. Then, Together, we will decide what things will work best for you, and you will decide what you can do. We will work with the utility and management companies as a team to help make your home warmer and safer and to get the lights turned on. So in summary, behavior change is complex. It's multifaceted and many solutions are needed, and that's why we're suggesting we would like you to begin learning how to use both motivational interviewing and cognitive behavioral therapy to try to prompt behavior change with My Choice participants. Thank you.